Well, good morning, everyone. Welcome to Washington Post Live. I'm Fred Ryan, publisher, and I would like to thank you for joining us this morning, this early morning, for an important discussion about the future of America's health. This year, the United States is expected to spend over $3.8 trillion on health care, a number that approaches 1/5 of our total GDP. Yet in each of the last 3 years, life expectancy for Americans has actually been in decline. And with voters saying that healthcare will be one of the most important issues for them in 2020, the state of America's health will feature prominently in our national dialogue in the coming months. Today, we're fortunate to be joined by some of the most prominent voices in that conversation. We've brought together leading doctors and health experts to highlight innovative approaches to solving America's health challenges. From the importance of nutrition to the relationship between health and poverty, today's discussions will explore some of the most powerful influences on America's well-being. We're pleased to welcome world-renowned Dr. Deepak Chopra to the Washington Post Live stage this morning. In a few minutes, with the Post's Jonathan Capehart, Dr. Chopra will discuss ways that our emotional and physical health is being shaped by today's pervasive digital technologies. But before we begin, I'd like to thank the presenting sponsor of today's program, Kaiser Permanente, along with our supporting sponsor, the George Washington University Cancer Center. Now, as we begin the program, please join me in welcoming the Chairman and CEO of Kaiser Permanente, Bernard Tyson, and the President and CEO of the Alliance for Community Health Plans, Cece Connolly, for a special segment. Welcome, Cece. Thank you, Bernard.
Thank you, Fred. Good morning, everyone. It is nice to be back at my alma mater. A few familiar faces still left at the Post. I am thrilled to be here for this very important conversation, and so grateful to our ACHP member, Kaiser Permanente, for its incredible leadership on this issue. For those of you that are not aware, last month, Kaiser Permanente announced a very exciting new initiative called Thrive Local. And today, Bernard has some brand new national survey data that sheds some light on social needs and communities and what the American public is really stressed about, as we were discussing earlier, Bernard, as well as you're able to tell us where you're going to launch Thrive Local this summer. So do you want to kind of touch on a couple of those high points to start?
Sure. Good morning, and it's great to see you and great to see everybody up this early. It really is early if you're coming from California.
For you. At least there was no Warriors game last night keeping you up.
But tomorrow. Really is great to be here. As you know, this is a critically important topic and strategic area for Kaiser Permanente, and we would argue for this country. And we are very pleased to be in the middle of helping to shape the narrative that many more would need to be actively involved in. And so this mega issue that we have going on requires all hands on deck. And so Kaiser Permanente is committed in each of our communities and around the country, but it also requires many more who are also figuring out how to get more involved and engaged in everything. So the survey for us is validating to us that we're on the right track, that as you think about health and healthcare in the 21st century, as we begin to shift from all of us relying on a healthcare system that's there when we get sick, to a healthcare system that is there to maximize the healthy life years of individuals. The ability now within the healthcare system to detect issues going on inside of your body earlier and earlier, as we've been able to prove inside of Kaiser Permanente, is the best form of medical care. Because you go upstream, you deal with it early on, you manage it with the patients through our Permanente physicians, and then you end up in the teams and you end up with a better outcome. Well, this takes it now to the next level, because this says we acknowledge that medical care plays a very important part, but it's not the total solution. And so as we think about living healthy lives in the 21st century, there are other factors that affect that very directly, and we've been talking about that. Where you live, your zip code, and what the infrastructure is in your zip code affects your health. And so we've spent a lot of time over the years talking about those areas in the country in which it lacks the basic infrastructure, like grocery stores, like a secure environment for children to go out and play, like school systems that are lacking the resources to both encourage and enlighten the students of the 21st century. And so now what we're doing is we're looking at the social needs in the communities that helps people to live healthy and fulfilling lives. One of the major things missing is a coordinated way for people to tap into those resources as needed. Mm-hmm. And everybody is there trying to fend for themselves. And so the survey that we did, I think we are both encouraged and amazed with the alignment of what the American people are feeling, consistent with the needs that we're trying to get addressed in the country. And so the people in the survey were clear that they see a direct connection between their housing situation, the lack of foods, the kinds of things that are stressing all of us in the 21st century is affecting their health from their own personal perspective.
And the other thing that really came through in the survey data, if I remember correctly, more than a third saying they're just not certain where or how to find resources. And that's really the bridge that you're trying to create here. Is that right?
Yes. I mean, you know, when you look at the ongoing resources that have challenged if you will, the social need infrastructure throughout the years, you have a lot of great organizations, a lot of nonprofit organizations and other organizations who are doing great work, but in many cases they are one-off. And so there isn't an integrated approach where someone can tap into those resources with ease. We are an integrated system. That's our competency. We know how to integrate and to connect the dots. And we are a mega health system, right? And so we cover 13 million members, technically 12.4, but we'll round up to 13 million.
Sure.
And we exist in communities with 68 million people. And so our line of sight is 1368. And so we think that way all the time, and we can bring resources with the competency to integrate and connect, and then we put it on the backbone of technology. And so that's what we want to bridge.
And I'm so glad you brought up the word integrated, because as you were sort of saying in your opening, too much of the healthcare system in our country today is an acute care treatment system. Right. And I would argue it's because too much of medicine is still fee for service. You pay to have something done to you. So of course the Kaiser Permanente and all of our ACHP members have a model that's different. So maybe just share with this audience, in the case of Kaiser Permanente, when you have the health plan, you have the physicians, the nurses, the hospitals, and the community now all coordinated with the aligned incentives. What does that give you the ability to do that might be hard in fee-for-service?
Yes, you know, when you look at the challenges of the healthcare system in the 21st century, on one side, I wake up every day excited about the new possibilities. Things that we see happening now that gives me great hope about the future of where health and healthcare is going. So, you know, inside of the Kaiser Permanente system, we have patients who will be in our operating rooms this morning, many of them in the outpatient setting, but also inside of the hospital, getting a knee or hip replacement, and by this evening they're going home. I mean, unbelievable. We have patients who will be in today and they will have a heart procedure, maybe cleaning out the arteries or something inside of their heart, and within 24 hours they will be home with all of the home care and a support traveling with them. We are now living in the 21st century where we are thinking through how now to prepare for more curative medications and other ways in which we now see a future where some of the diseases we can cure. And we saw that miracle, if you will, with hepatitis C. We now have systems like in Kaiser Permanente where you're connected 24/7.
Yes.
So I can reach my doctor at any given time, and I do. I love my doctor. And so you have all of this. The big question, though, is who's going to pay for it? And as a bigger society, are we willing to say in the 21st century that some should have this and others should not? And some of this is very expensive. We have a healthcare industry, we have a system that pretty much is fee for service, that the chassis is I do more, I get more. We demonstrate inside of Kaiser Permanente with our prepayment system, with total integration where all the key stakeholders are sitting at the same table. And so when we look at, as I call the whole dollar for a patient, we have all of the key stakeholders together for us to decide together the best use of that dollar for our members and for our community. If you're only coming at this from the hospital system standpoint, you naturally are thinking about what portion of that dollar do I need to advocate for and together.
The old phrase is butts in beds.
Exactly right. And so you end up with a very fragmented system in which everybody is chasing, as I call it, the incentive around the same dollar. Inside of Kaiser Permanente, in the center piece for us are our members and the communities. So our conversation is about what's the best care possible and health-related services possible that we can give to our members and to our communities to maximize their health. That's a very different conversation than how we're going to deal with patient days and the revenue sources, et cetera.
And so let's extend that, though, because even though Kaiser Permanente, again, like all of our ACHP members, mission-driven, not-for-profit, but no mission, no margin, as the cliche goes. This social needs initiative that you're now launching this summer and is a big undertaking, is there going to be an ROI? What is going to be the ROI?
Yeah, I mean, the answer is yes, and no mission, no margin. But we consider margin like air. You need air to breathe, right? The only time I worry about margin is when
there isn't any.
None, right? But the difference, though, is that the margin goes back into the mission. So that's, for me and for Kaiser Permanente, that's the perfect system. That we still look at the management of the total dollar. And so right now, less than 3 cents of the dollar goes to the bottom line. In fact, it's closer to 2 cents. And that's more than adequate for the strategies that we're deploying to go back up into the system. And so it's a holistic approach in how we do this. And so inside of that, inside of those economics, we are investing in our communities, which is part of the benefit and expectation of a large 501c3. And we are getting the returns both by meeting the social needs of the communities, as well as the funds working back with more efficiencies being provided to the overall system that we get to put back into better rates for our members so they don't have to pay as much.
Correct me if I'm wrong, though, but isn't this network, this social network that you're deploying, aren't you going to make that available to lots of different organizations that are not Kaiser Permanente?
Yes, and that's what I mean by our 1368 line of sight, that we are investing in and building capacity that can go far beyond the 13 million members that we're honored to take care of. it can also reach into the communities and help many others in the communities. And so we have an all-in strategy to work with other health systems and other civic organizations and the likes to end up with a holistic approach that many millions more can get their needs met.
So housing, food insecurity, transportation, bring this to life for me. In one of your regions, you're based in Oakland. Paint a little picture of how the heck that affects my health.
Well, think about the basics of life, food, right? The survey says what we know, but validates that many people go to bed hungry every night. Many people make choices about how many meals they can eat in a given day, and which ones in their value system is the most important to do. Many of our medications requires eating on a stomach with food in there.
Right.
So think about someone taking medications that's completely opposite of the recommended approach to dealing with that. The survey shows us that people are making life choices in their homes every single day. Do I buy the milk or do I get the medication? When we have the lack of a transportation system in communities, then people can't get around as much as what some of us take for granted on a daily basis. I think the worst of all of this is individuals who only address is the streets of America, and those are the homeless. Many families are right at the edge of homelessness. I think the bigger societal question for all of us is, what do we accept as a basic American life? And I would argue a shelter over your head is one of those things. So these aren't simple issues that we're addressing in the 21st century. These are real issues. I think the other thing that is clear is now that we're all wired 24/7, now that social media is affecting all of our lives day in and day out, and we certainly are focused on young people because we see the direct relationship of social media with depression and all forms of social challenges. How do we begin to think about a holistic approach of how we address all of this, all intended to help people simply cope with and live and aspire to have the best life possible?
Yes. Well, incredibly, we're out of time, but please join me in thanking Bernard Tyson of Kaiser Permanente.
Thank you.
It's the daily podcast here at the Washington Post. Maybe there's some listeners in the house. Thank you, over there. I'm delighted to welcome our guest, Dr. Georges Benjamin, Executive Director of the American Public Health Association, and Dr. Shariki Kumanika, Research Professor at Drexel University. And during this panel, we're going to be taking questions via Twitter. So use the hashtag #PostAlive to submit your questions. I want to start with a statistic. So according to a 2017 medical journal, the richest Americans live an average of 15 years longer than the poorest Americans, which I think to some of us is really shocking to have a sort of, to see wealth quantified in terms of number of years of life. But to other people, I think it's actually just very validating that we've always known that there is a real life cost to being poor. So Dr. Benjamin, I'm hoping you can just start by explaining what is that correlation between income and health?
Well, you know, it's every community has this. You know, we know this visually. It's called those folks that live on the other side of the community, or the folks on the other side of the tracks. Every community has that. And, you know, it's real. Even here in Washington, D.C., there's almost an 8 to 10 year life expectancy difference between right where we are right now and Gaithersburg, Maryland, those of you in the region where I live. And it's due to a whole range of activities. It's due to wealth. Wealth gives you access, your zip code gives you access to employment, housing, education, a whole range of services. And you heard Bernard talk a bit about what they're trying to do from the healthcare system. But there's a whole opportunity to fix that from a social perspective.
And Dr. Kumanika, can you explain how does race come into play when we're talking about disparities in health?
Race is farther upstream than the factors of income and education. You can look at they're the behaviors that lead to health, or the exposures to the environment that lead to health, and then they're the immediate factors that determine those. But then you have to look to say, well, why is income low in some communities, or why do people live in certain neighborhoods? And you get to race and discrimination. So the reason that race is in the picture is because race has been the basis for directing opportunities and resources, or depriving opportunities and resources for people of color. And then it leads to the poverty, the education issues, and the lack of jobs and so forth.
So then let's start talking about potential solutions, and maybe let's start with the government perspective. What can the government and policymakers be doing to address some of these kinds of disparities?
You know, you heard that we're going to spend almost $4 trillion on health care, prospectively. And just remind you that, I'm an ER doc, and it's very painful for me to mention that 80% of what makes you healthy occurs outside the doctor's office. It's a very painful understanding. But once you understand that, that means that there's some things you can do. You can spend a lot of time trying to get people to stop smoking, smoker by smoker, or you can stop people from smoking in the first place by using a population-based approach. We know that, you can, treat every kid for lead exposure, or you can get lead out of the environment in a population way. The solution to homelessness is a house. And we know that once you get someone in housing, you stabilize them, and then you can provide effective health care to that person. It's very tough to chase people around the city who are homeless.
Dr. Kumanika, what do you think?
I think that we really have to go upstream and look at how we got here. So we have to, why are certain policies prejudicial to certain parts of the population? It's not an accident. So if I say to you, poor people have poorer health, you know that. If I say to you, why do poor people have poorer health? Then is it the people, or is it society and those opportunities? So when you talk about homelessness, where do we get these policies that allow certain people to have homes, and go pretty far upstream to the causes of the causes of the causes? Because I think, the solutions that doctors have will not work if we just keep with the workarounds. If we fill in that gap today, we have to go and have permanent solutions designed very carefully so that we don't repeat the mistakes of the past. Well, they weren't mistakes. Some of it was intentional, unfortunately. A lot of this was intentional.
Yeah.
So we have to face that, and we have to make policies that are going to be fair and give everybody an equitable chance, not an equal chance, but an equitable chance, because we have to make up for past wrongs.
I'm also curious, what do you think that doctors could be doing to take into account some of the social and economic factors that affect the health of their patients? Which, as you sort of nodded to, doctors have not always been good about thinking about health in those ways.
Well, certainly, you can write the social service consultant, consultation, just like you write one for the OBGYN doctor or for the ENT doctor. But if you really want to make a difference, then recognize the social conditions that your patients are in and engage in a collective way through your society, and show up at the public hearing for the public health budget, show up for the housing budget.
The doctors should be getting more involved in policy making.
Absolutely. And for all those doctors that say that it's not their business, I remind them that when they took an oath, that anything that hurt people or kills people is theirs. That means transportation, that means lack of housing, that means poverty, that means racism and discrimination. It hurts their patients because they're stressed, and stress changes your hormones, and it results in really, really bad health outcomes.
Yeah, I think doctors have an incredible amount of social capital. And even though a lot of people like Dr. Benjamin in public health are doctors, it's the doctor in the white coat that people are thinking about. And that social capital must be used to influence policymakers. But the other thing that doctors can do is to use the access they have to real people to find out what do people need, what kind of policy should we have, so that when they're designed, they actually meet people's needs as a whole. Because the average person who's socially disadvantaged has 6 or 7 of these problems going on all the time. It's not just like they don't have a home. If they have a home, they have other needs. So I think doctors have both, could be on both ends of that spectrum.
That they can serve as kind of a translator between the needs of the community
Exactly.
and how it becomes enacted in policy.
Exactly.
I also want to hear more from you, Dr. Komenica. You know, a lot of your research has focused on nutrition. And I think that a lot of us hear about the concept of food deserts, and that there are parts in cities that have less access to healthy, quality, affordable food. How do you see food policy and nutrition playing a role in changing some of these disparities?
That's a great question. I think that food and physical activity are 2 of the personal behaviors that are related to so many of the health problems people have. Food policy has two goals. One is to make sure people get enough to eat, and the other is to make sure that they're eating the kinds of foods that are going to support their health. We have food policies that do part of these things, but we still are not ensuring that the food system is favorable to health, because food is commercially mediated. It's not a public good. And right now, when you put that supermarket there, for example, you've got to look inside, and you've got to see, are the sodas on sale the same day that SNAP benefits are released on the cards? And what do people see when they come in? Is it the stuff that we think they should be eating, or they even think they should be eating, or is it the stuff that calls to them in other ways?
And so much of the rhetoric around this kind of stuff focuses on choices and making good choices, and sort of shaming people for making quote unquote bad choices about nutrition. And I feel like there's not enough attention on the fact that a lot of those choices are determined by the ways that people's environments are telling them what they should be eating, what is most affordable, what is most efficient to buy for their families for food and drink.
Yeah, it's true. If you take things to their illogical conclusion, the food system can give people foods and in quantities and marketed in ways that make no sense at all from a health perspective. We're trying to get a handle on that, because the counseling that happens in the doctor's office, for example, won't work if there are just hundreds of messages coming, say at children, all the time, telling them that they'll be cuter if they eat a certain type of thing or whatever. Mm-hmm. So I think we have a long way to go in getting everybody on board with a goal of health, and seeing how can a food business make money supporting people's health, rather than only just delivering things that taste good, because it's not working.
Yeah. So when we're talking about healthcare costs, should we be putting more money toward social programs? And what are the best investments for a comprehensive approach?
Well, there's no question we need a new social compact in our country, where we invest in those things that help people. If you actually look at our expenditure as a country, the balance between health care and social services, there's a disconnect. If you look at how we compare to other industrialized nations, where we're at the bottom, I might add. We spend twice as much as they do, and yet we're getting the bottom of our health. There's an imbalance between what we spend on social services and health. We need to rebalance that equation, not just within those two disciplines, but within our whole society. So that
Can I
people.
stop you there? Why is there such a difference between the health, when you compare the U.S. to other developed nations? Why are we getting so much less for what we're spending on?
Well, you know, if you really look at why we're different from other nations, the first thing is we don't have a system with everyone in and nobody out. We're the only industrialized nation in the world that doesn't have universal health care for all of its citizens. However you define it, however you pay for it, we're the only one that doesn't have that. We spend a lot more on treatment than we do on prevention. Yes, we can do amazing things in treatment, but should we have to? We don't spend as much on, as I said, the social compact that we need to do, and we have one of the most fragmented, complicated systems in the world, not in just how we pay for health care, but actually how we deliver it. And there's enormous opportunities for things to fall through the cracks, and they do each and every day.
What are the chances that this is going to get better?
You know, Churchill's comment is that we will try everything until we finally get it right. Whatever the actual quote is the way we do it. The reason we got the last healthcare reform was because the status quo was not acceptable, and we're going to do the next healthcare reform when the current status quo is not acceptable. But we're getting there.
I'm curious how you see this changing over coming years, especially when it comes to things that we're still wrapping our heads around, like the public health effects of environmental changes and climate change. Is that something that you're worried about, the ways that climate change will affect general public health, but also specifically for poor and Black and brown people?
Climate change is the most pressing public health problem we have today. It's more dangerous than anything else we've got. And yeah, I'm worried about it. I'm worried about more severe storms, including more hurricanes, more tornadoes. If you were in DC just yesterday, we had lots of, you know, severe storms in our region, including hail and high winds, et cetera. That is not an accident. That's happening because our climate is changing, and we are part of it. And we actually know the solutions, the science is there, and we just have to press on it to try to fix it. And as you pointed out, the people who have are the least involved in creating the problem are the most impacted by it. You know, think, you know, New Orleans, think Houston, think Puerto Rico and the Virgin Islands. You know, those are examples of the disparities that we're seeing.
Dr. Kumanika, how do you see climate change affecting?
I agree totally. Besides the fact that climate change is our biggest problem as a whole, it is the most vulnerable, the people with the least power and resources who can come back from it. Because once a disaster happens, you know, guess who can go out and build a new house? Guess who can get their kids back in school? And guess who can't? So it's a general problem, and it's a part of health disparities. And a lot of people don't realize that. They think, oh, that's way off there. That's the North Pole and some polar bear that nobody cares about. And what about here? Well, here,
It's coming for us too.
you have probably kids that are still not in school because the school was blown away and the community is not able to really create that again.
Yeah. We have a question from Twitter from Laura. She says, if you could have a set or points of data about this crisis, the addicts, the demographics, or other patterns that you currently don't have, what data would help you make the most impact in your work?
Well, for me, it's the timeliness of data. We're data historians. When I was doing infant mortality work here in Washington, D.C., I was looking at data that was 2 years old. We need to build data systems so they're timely as the grocery store in town, which can tell you exactly what's coming off its shelves because, you know, of the barcodes that are going through the, you know, the registers. The problem with the public health system is that we're always doing data in the real, and that's a real problem for us.
I'm probably going to give an answer that is not expected. I think we need history first to change people's minds about how we got here. So we have a lot of data, but sometimes when people see the, who's worse off on the bar graph, they think it's their fault. So we can show that these things make a difference, but can we convince the sort of right-minded people that this has actually been created and needs to be looked at a really upstream way? So we have the data, but sometimes the data also reinforce the idea that there's something wrong with the people who have the problem. So.
Unfortunately, that's all the time we have. But thank you so much, Dr. Georges Benjamin and Dr. Shariki Kumanitha. Thank you for joining me. I'm Martine Powers, and we'll have our next segment soon.
Thank you.
Good morning. I'm assuming since the video is over, we are live. I'm Jonathan Capehart, opinion writer for the Washington Post. And I would think that the man next to me needs no introduction, but I'm going to introduce him anyway. Dr. Deepak Chopra.
Thank you.
World-renowned pioneer in integrative medicine, author of several books, actually author of 86 books. Is it 86 or is it more now?
Something like that.
Around there, with a new one coming out in October. You are the founder of the Chopra Foundation, co-founder of the Chopra Center for Wellbeing. Welcome to the Washington Post.
Thank you, Jonathan.
So we just saw the video there about loneliness and social isolation. And I would like to get your take on all the research that show we're addicted to technology and that the inordinate amount of time we're spending on our smartphones and on social media is interfering with all sorts of things, from our relationships to sleep and productivity. Is that research correct, and are we actually in a loneliness epidemic?
We're definitely in a loneliness epidemic, and all the research does show that social engagement and social and emotional well-being is directly connected to everything, including inflammation in the body, chronic illness. Only 5% of disease-related gene mutations are fully penetrant, which means they guarantee the disease. 95% of even the mutations that are connected with chronic illness, and doesn't matter what the illness is, cancer, heart disease, autoimmune illness, Alzheimer's, 95% is associated with what is called low-grade inflammation in the body and also in the brain. Alzheimer's is one of them. And this is connected to lifestyle. And the most important lifestyle measure is social, emotional connection. Mm-hmm. But having said that, technology is neutral. It's up to you how you use technology. You can send somebody an emoticon with a kiss and a hug, and you can give them a dopamine hit right now. It doesn't matter where they are, in South Africa or Botswana or India. Mm-hmm. So we can use technology these days. There's deep learning, there's analysis of microbiome, you can monitor your sleep, you can monitor your stress levels, your movement, your exercise, your breathing. To me, this is the next frontier. We'll be using technology, including VR and augmented immersive experiences, to actually reinvent the body, literally, at the level of information and energy.
Okay, so now I'm confused. Because on the one hand, we're suffering this, we're constantly on our phones and our iPads and technology, and it's driving us nuts, and we're not going to sleep.
Because you're being victimized by technology instead of you being in charge of it. So schedule time for technology. Put it away. I mean, as we were walking in, you were on your thing. Okay?
Well, yeah, because I took this fabulous picture of you, and I wanted to tweet it out.
Even as we were getting on the stage, you were focused on that.
Yes, I was trying to get your Twitter handle out there.
I don't carry a phone unless I'm using it right now, and I'm not using it. So, you put it off. Just like you'd have sleep time, you have technology time, you have exercise time, you have social engagement time. We're blaming technology. We invented it. We are not its slave. We are its creator. And we can use it actually to create social justice, economic justice, well-being, health, and joy if we want to, selectively.
Okay. Well, I want to throw out this statistic that just blew my mind about loneliness, and this is from a study. Loneliness and social isolation can be as damaging to health as smoking 15 cigarettes a day.
That's correct. And that is because we are living in a society where there's emphasis on performance and misrepresentation of what success means. If success for you means all the time working hard, driving ambition, exacting plans and goals, then you will succumb to the modern epidemic of stress, which is directly or indirectly related to almost every chronic illness and addictive behavior that we have. So it is true. Social intelligence, social engagement, having friends and family that care about you, but also your career. Do you have meaning and purpose in your life? Other things, community well-being, social well-being, physical well-being, emotional well-being, even financial well-being. Because if you're thinking all the time about money, and that happens to two classes of people, the extremely poor and the extremely rich, they can think of nothing else except money. So they share the same stresses, the poor and the rich. It doesn't matter if you're rich. It doesn't mean that you're sleeping well, that you know how to manage stress, that you're eating well, that you're getting exercise. It doesn't make a difference. I mean, I've heard all this demographic about poverty, but the most important things in your well-being are sleep, managing stress, movement, taking a breathing break, emotional connection, eating right, and once in a while connection with nature, and you're all set.
Doesn't that sound so simple?
It is that simple.
Okay, doctor. I forgot to remind everyone, if you here in the audience and who might also be watching live stream, that you can tweet your questions to us using the hashtag #PostLive. Dr. Chopra, let me bring you back to this notion that we don't have to be slaves to technology because we invented technology. But isn't social media designed to enslave us, designed to give us that, by the engineers, to give us that dopamine hit, to constantly be touching our social media, to be tweeting while coming on stage?
If you're a victim to the hypnosis of social conditioning, yes, but you don't have to be, okay? As I said, schedule it, and actually technology these days is being used, I use it, for creating online and offline communities of well-being. So, there's a combination of well-being communities. If I create an online community of well-being, around a specific purpose, losing weight, sleeping well, managing stress, educating people about nutrition, then that very technology that we are criticizing can actually help us create an ecosystem of well-being that is both online and offline. So I ask people, instead of posting their selfies on my social network, they should post their welfies.
What?
A welfie.
What's a welfie?
These days with facial recognition, eye movements, you can create algorithms that actually look at your face and can immediately predict whether you're stressed or not.
Right, and then what happens?
So we ask people to post on our well-being app a welfie and a purpose connected to it, and then engage with other people with that as well. So you start creating data with facial recognition on how people are motivated to improve their well-being, whether it's losing weight or exercising or connecting with each other.
So then, aren't you creating, in a well-being sense, at least with the community that you're developing and have developed, a sense of FOMO, of fear of missing out, which is one of those things that in my reading adds to the anxiety.
I'd love people
isolation.
to feel they're missing out on a conversation that is so important, which is the future of our well-being. And the future of our well-being depends on social and economic justice, sustainability, as was mentioned, conflict resolution, and everything we can do to improve our personal and collective well-being. All the data is there, all the methodology is there, and we can use technology to our advantage. Technology is here to stay. It's part of human evolution. If you think you can get rid of technology, good luck. It's not going to go away. So how are we going to use it? That's the question.
What about those of us who have a hard time, and I'm actually better than it looked then. Like, I do put my phone away. I'm not constantly on it. But what would be your advice to folks in this room and who are watching for whom the phone is like a third hand, that they can't tear themselves away, that their work
Take a sabbatical or a Sabbath from technology every day for at least an hour or 2 hours. Put it away and see what happens. Life will go on. In fact, life will be much better. And at the same time, you depend on technology these days to get an Uber, find out where you're going, etc. Your GPS. So you can't get rid of technology.
But what about people for whom their job requires that they be in constant contact? My colleague here, Robert Costa, covering the White House and the goings-on in Washington, he can't possibly take a 1 hour sabbatical or a 2 hour sabbatical. How do you do
15-minute sabbatical. Okay.
What you're saying is find the time.
You find the time and you tell your colleagues, I'm not available for the next half an hour. What's the big deal? The world won't change.
And those folks who, one of the other problems, especially in our industry here at the Washington Post, is a lot of, and in media in general, is a lot of emphasis, one on social media, but also on likes and followers and clicks. And that adds to this constant feeling inside that you've got to be doing things on social media to bump up all of those numbers, which requires us to be addicted and hooked on these things. So what can you tell our editors
to free us?
There's
a biblical expression, what good does it do a man or a woman to gain the whole world and lose their soul? The modern equivalent is, what good does it do to you to sacrifice yourself for your selfie? Which is what we've done. So, people are so keen on getting validation, and that's because media builds it up. I mean, part of the problem is the media, which thrives on melodrama. And without melodrama, there's no news.
And you've just answered the next question I was going to ask about the 24/7 news cycle and whether that's a good or bad thing. You think that's a bad thing?
I check news once in the morning and once in the evening. It takes me 10 minutes. You know what's in the news in the morning, you know what's in the news in the evening. Why do you need more news?
Because we have a president who is constantly doing things that are in the news.
Here you pointed out a very important thing. And this is the future of health of the world depends on how we take care of our children. If your child gets attention, which means is heard, appreciation, its qualities, good qualities are noticed, affection, it is cared for, acceptance, then you grow up to be a healthy adult. Otherwise, you could become the president of the United States.
Okay. All right, so then, to continue on this line then, what advice would you give the president about his social media habits?
He's beyond hope. So I have no advice for the president.
No, so your suggestions of a sabbatical, a social media sabbatical,
do not apply to people who are that emotionally challenged.
So then okay, so that's the president. He's beyond hope. But what about the rest of us? The
rest of us, please make sure you go to vote next time, especially the millennials and the minorities and the women. Go and vote. Don't complain, because otherwise you'll get what you deserve.
In the meantime, though, in all seriousness, Dr. Chopra, there's a lot of time between now and Election Day, and the tweets are coming constantly from the air, 12 hours ahead, 6 hours behind. How should we cope with that kind of onslaught from anyone, not just the President of the United States?
I think the key always is self-awareness. Okay, if you're not aware of yourself and what motivates you, if you become a bundle of conditioned reflexes and nerves that's constantly being triggered by people and circumstance into predictable outcomes, then you're at the mercy of every stranger on the street. You have to seek your validation within yourself. The more self-aware you are, the more you'll be aware of what's going on in the world. Because the world that we interpret is an interpretation of how we are feeling at a particular moment in time.
So you did a video for CNBC late last month. If you go online, you can find it. It's from May 21st, where you talked for, I think it's about 3 minutes, about various things. You had tips. The first tip was be present in the moment. This gets to what you were just talking about. For people who hear that, we hear that all the time. You have to be present. You have to be present. What exactly does that mean? And how do you do that? How do you be present?
Let me show it. May I?
Oh, please.
So, are you present right now? Can you be a little more enthusiastic, please? Are you present right now? Okay. So let me ask you the same question, but don't answer it this time, okay? Till I raise my hand, and then you can answer it. Are you present right now? So, are you present? That was a thought. It was a question in the form of a thought. The answer, yes, was also a thought. But in between is presence, and that presence is you. So let me ask you the same question now. Are you present? And don't answer it at all. Just be aware of that which is present, which is you. Are you present? So this presence that we all feel right now is what spiritual traditions call the self or the spirit. We don't have to use those words. It's just presence. It doesn't matter where you are. You can be present any moment by asking yourself, am I present?
Oh, okay. The next tip that you have is make conscious choices, which seems rather obvious, but because you are you, there must be a deeper meaning there. Make conscious choices.
So I start my day with 4 intentions: a joyful, energetic body, a loving, compassionate heart, a reflective, clear mind, and lightness of being, which means take it easy. And then my day is organized around those 4 intentions. So I don't make choices that are a waste of time, energy, or resources. I'm what they call an energy miser. I save energy. And I can say that's actually probably one of the best ways to know how healthy you are. According to Gallup, if I asked everyone in this room on a scale of 1 to 10, do you have all the energy that you want to have to do all the things that you want to do? Level 10 being the best, level 1 being the worst. And if you intuitively say 8, 9, or 10, you're thriving. If you say anything less than 8, 5, 6, 7, you're struggling in some area of your life. It could be worried about the president or whatever, or about your finances, or about your relationships. And if you score less than 5, you're actually suffering, and there's something that must be addressed in your life right now. It's that simple.
the the next tip was take breathing breaks.
The normal breathing rate is about 14 per minute. When you slow your breathing to say half that or 8 a minute, and you can do that by just counting 4 on the in-breath, pausing for a couple of seconds or even 1 second and counting 4 on the out-breath, equal, you'll reduce your breathing rate to about 8. And that stimulates what we call the vagus nerve, which is the parasympathetic nerve that is responsible for self-regulation in your visceral organs, including your heart. It influences your heart rate variability. So if once in a while you can take a break and just slow down your breathing, even for a minute or two, that's a breathing break.
And in the 2.5
Breath is the basis of existence. When people are stressed, their breathing is irregular, it's faster, and so on.
Right, and we have a little bit of time left. The last tip was practice daily meditation, 15 to 20 minutes twice a day. And when you say this in the video, there's a woman in a chair with headphones in the middle of an office. So is the signaling there is to do this meditation, to put down the social media, to shut out the world, and you can do that anywhere you want or need?
Just like you can think a thought no matter where you are, you can learn not to think no matter where you are.
Really?
Yes,
Really, to learn not to think.
That's the highest intelligence, is the ability to be instead of always being triggered by your internal dialogue. We're human beings. We're not human thinkings or human doings. You start with being, feeling, reflecting, and doing. That should be the sequence.
And back to the original topic that we sat down on the stage to talk about, the loneliness epidemic. For anyone who might be in the audience or watching, who might have come to the realization as a result of this conversation that, you know what, actually I am lonely, and social media is probably the thing that's driving it.
Make a list of all the people that you care about and give them a little attention, affection, appreciation, and acceptance, and you won't be lonely. The best way to be happy is to make somebody else happy. Instantly brings you out of your loneliness.
Dr. Deepak Chopra, thank you very much for being here.
Thank you. Thank you.
And at this time, we're going to move on to the next portion of our program. Again, Dr. Chopra, thank you very much.
Jonathan. Thank you.
Not livelier. Yes.
Very present.
Very present, yes. Hello, everyone. Thank you so much for being here. I'm Mary Beth Albright. I am the food anchor here at the Washington Post and the host of several series, including Secret Table and Food Hacks. And I am so pleased to have two great minds in food and public health here with us this morning. We have Eric Ajapong, who is chef and co-owner of Pinch and Plate, and was also a finalist on Top Chef. As you probably know him, yes?
People's choice, though, let's just say.
Definitely, yeah. People's choice, absolutely. And Yael Lehman, who is president and CEO of the Food Trust. So two really great minds here. And a reminder to our audience and to myself that you can tweet your questions to us using the hashtag #PostLive.
Sounds good.
Yeah, absolutely. So let's get at it. Yael, I want to start with you. And we use the term in the video, food deserts. I've spoken to a lot of people who live in areas without access to fresh foods. A lot of them don't like the term and say, don't call my area a desert, just use the term low access to fresh foods. The USDA says that it affects 15 million people, 11% of DC. And it's interesting because when I first heard the definition of food desert, and within, you don't have a grocery store within half a mile, I thought to myself, well, half a mile seems not that far away. But then you think to yourself, people don't have vehicles.
Yeah. Right.
And you think to yourself, if you have a vehicle and you do your weekly grocery shopping trip, you load up on groceries but people who don't and have to take a bus or other public transportation, that's difficult. So what contributes to low access to healthy food? What are those factors?
Yeah, well, it's interesting. The term food desert is controversial. Actually, it's not a term I like either. And also, in what we call underserved areas or areas that have low access to healthy foods, a lot of times there is actually a ton of food. It's just bad food or low quality food, processed food, unhealthy foods. But also the term desert, it doesn't bring up a great image, and it's not. It can come off as disrespectful towards different people's communities, and also. I know in our work at the Food Trust, we're very interested in transforming communities so that there's farmers markets and high quality supermarkets and great food in the corner stores and in the school cafeterias and all of that. And as you try to motivate people to do great things, talking about a desert doesn't exactly get your enthusiasm.
You live
Let's go to the desert.
Let's try to do something in a small way. Right.
Exactly.
Yeah.
But there's a long history of disinvestment. There's also Shriki Kumanyika, who actually was on our board of directors for many years, and I'm a big fan of hers. She's one of my heroes. But as she was talking about too, there's a long history also of institutional and structural racism. Low-income communities and communities of color. There's a long history of redlining communities in DC and Philly, where our organization is based, and others. And there's this history of where banks actually wouldn't give resources or loans to people who wanted to open up businesses, including food businesses.
Is this what you mean by redlining?
Exactly, what's also known as redlining.
Yeah.
So when you look back, when Shariki was talking about looking upstream, it's important when we think about how did this all come about. There's a long history about how that all came about.
Yeah, it's really interesting. Upstream. I think when you think about public health in that sense, that's a really interesting term, because one of the first lessons I learned in school was if you see, it's pretty morbid, but if you see a body going down the river, you question yourself, why is that body going down the river?
Right.
You see another one, you're like, okay, what's up? You keep seeing 3 or 4, and then you're like, okay, what's the source? Why is it happening, right? So you want to go to the source and actually figure it out, that upstream, right? What's the issue? What's the genesis of the problem? You go back to poverty, you go back to the racial discrimination, you go back to the redlining.
Yeah.
There's so many little factors that actually contribute to the macro problem,
Well, and this is important, I didn't mention it in my introduction, is that Eric actually has a master's in public health, which when we were talking about what chefs should we have on to talk about public health, he was my first choice, because I love it when people have a master's in public health and something else, because I think the public health, it connects with everything.
For sure.
And when people are chefs and MPHs,
Yeah.
I mean, and you've been on the ground in DC for so long.
Sure.
I mean, you've had boots on the ground with this. What do you see being done out there? I mean, people ask chefs and tap chefs to do so many different things with the community. What do you see out there that's working, what's not working on a micro level?
On a micro level, I think, one, keeping people's dignity intact is huge. We're talking about food, but we're also talking about like the access to food and being able to go out and with dignity, with pride, go out and buy food. Like that's a tangible thing that people want to feel good about. You know what I mean? So just educating people on the right ways to buy food, how to look for like freshness when it comes to, like, I remember even in New York when I was out there doing a program with Harlem Children's Zone, Healthy Harlem, we would do like these supermarket tours, and I would essentially go to the produce section and show children and parents and grandparents and their guardians what cantaloupe looks like or what a honeydew looks like, and tell them how to hold it and check for freshness and things like that, things that they've never experienced. That's the part of the dignity that I really love, giving them that power to say, I can go to any supermarket in the world and know how to pick a really fresh watermelon or know how to pick something. That right there is, you teach a man to fish, he lives forever, right? So that's the type of access and dignity that I really, I think is huge, and is a really big pivotal part into like the first step to security.
And dignity is, I'm glad you brought this up, because I mean, moving on to the federal government, which is a much bigger picture, obviously, but we're here in Washington, let's talk about it.
Yeah.
We're talking about SNAP and WIC and those programs. Do you find that there is still a stigma involved in that, or is there a stigma, and especially with the federal debates that are going on with that, and the kind of foods that are allowed, are not allowed? What's going on with that? I know.
What do you think? Yeah.
Stigma is a big part of this, and policymakers have stigma around folks that, so if folks here aren't aware of the SNAP program, it stands for the Supplemental Nutrition Assistance Program, formerly known as food stamps. And so, yes, there's a huge stigma around on the policymaker side. We also found that on the recipient side, that it can be a barrier. So at the Food Trust, we've been working with a group, the Food Resource Action Center, FRAC, we always call them, based here in DC. They advocate for SNAP benefits. And together we've gone to 3 different cities, Houston, Denver, and Los Angeles, and we talked to folks about what are the barriers to people accessing SNAP. And part of it is personal. People say, I don't want to, it's like a personal feeling of shame. Which we need to change that narrative for people, because it's one of the ways, SNAP is so important. It not only gives you money in your pocket to pay for food, if you have more money in your pocket to pay for food, then the other money can for rent and everything else that you need in your life. And no, yes, absolutely. And on the policymaker side, we need to bring people here to the Hill to tell their stories so that people can meet folks and realize, hey, these are just regular folks. And most of these folks, it's just they're temporarily needing to be on SNAP. They lost their job, they had a health issue. And so we need people to be out there and telling their stories and explaining so that policymakers don't have a weird idea in their head.
For sure.
Yeah.
And also, I think another thing too about SNAP, and there's also different ways to spend those benefits, right? You don't necessarily need to go to a supermarket and spend the money that you get from, SNAP. You can go to a CSA, you can go to a church, you can get there's so many different community-supported agriculture programs out here in DC and just anywhere really, where you can use those benefits and get fresh food, and it doesn't necessarily need to be out in the open if you have that sort of shame or whatever. Necessarily, you don't have to, but I mean, these are options that are out there.
Right.
Yeah, and there are programs, I know, nonprofits and corporations who will double your dollars if you go to a farmer's market and that kind of thing. And those kinds of partnerships, I think, are important both on a small level and on a large level. I know there are nonprofits who will go into corner stores in places with low fresh food access and will say, we'll give you all of this fresh food and we'll buy it back if people don't buy it. Because, the corner stores are businesses too, and if they put out fresh food and people don't buy it, they lose money.
Sure.
They're a small business and they've got to survive too. So how important do you think those partnerships are, both on a nonprofit level and on a corporate level?
I think it's really important because it not only combines the mission, but also combines the community behind it, right? We're talking about eating healthy, we're talking about fresh food, we're talking about access to all of that. And it's great when you have community leaders spearheading these type of initiatives in the corner stores and folks that look like, the people that live in their cities and their communities. So if you see a gentleman or a lady that is, in a supermarket and is advocating, hey, eat fresh food, and we're taking up little stocks and slots in this corner market just for you guys to come in and food is, available for you. I think that's a really good start. Yeah.
Yeah, actually, that's the exactly kind of work we do at the Food Trust.
Yeah.
So that's an easy question for me.
Yeah, right.
Yeah, it's like the softball.
I mean, it should be, but it's not being done more.
No. But so at the Food Trust, we've been working in corner stores and accepting SNAP at farmers markets now for 10, 20 years. The corner store work in particular, I think, is wonderful, especially if there isn't a high quality grocery store in your neighborhood. Sometimes that's all that's available are these corner stores or slightly larger superettes. For example, what we call our Healthy Corner Store initiative. One of the stores that we work with, Ferry Avenue Market in Camden, New Jersey. We were talking with one guy, one of our staff, Anna Ramos. She was telling me the story of this one guy, Edward Logan. He's like 70 years old. He'd been going to the market every day, and he would go get lottery tickets and he would get food. But then he was diagnosed with type 2 diabetes, and then he realized he had to change how he was eating. And we had staff there, and we were doing, even though it's these kind of small stores, we have staff there that are doing cooking demonstrations and giving out samples.
That's awesome.
And so and then in the course of that, we also distribute, like you were talking about, these incentives which make healthy foods more affordable, handing him what we call food bucks. And so giving him $4 in food bucks that you can use to buy healthy food in the store. We work with the corner store operator to incorporate healthier foods.
Yeah.
And now he's telling us that his weight is down and his blood pressure is down and all of these things. So, being there in the corner stores is a great intervention point.
Perfect.
And it's a creation of a community, I would think.
Yeah, absolutely. I mean, this is where, you know, a lot of times people are coming to these small stores 2-3 times a day. We did one.
It's a great point. Yeah.
Right?
Yeah. It's an excellent point. People are visiting
Yeah.
these stores quite often, right? Because
That's it.
it's communal, right? I'm sorry to cut you off.
No,
That's
it's
valid.
really
Yeah,
true.
you're absolutely right.
So it's a great spot where also we've partnered with hospitals where they'll actually, it sounds crazy, but they'll actually hang out in the back of the store and they have like a scale.
Oh my God.
And they actually
funny.
take blood pressure. I'm serious.
Wow, that's awesome.
But it's worked really well. But it's also coming to where people are at.
Exactly,
You know?
exactly.
And,
Well, and that's the kind of thing during the first session they were talking about in the Kaiser study is how do you create that kind of community, right? Because if they didn't see that guy for a day, they'd be like, something's up.
Right.
And probably check in on him. And that's a kind of community that you can create given the infrastructure that we have now,
Yeah.
but also be forward thinking about how we can improve the infrastructure.
Right.
So we've talked about corporations, we talked about the federal government, we talked about state government, but what is the individual, there are a lot of individual things that individuals can do without taking any responsibility away from anybody else.
Sure.
So I'm thinking about like co-ops, I'm thinking about community gardens. Where does that fit in? I mean, I don't, it's almost like you don't want to talk about it because it feels like you're taking responsibility away from other things, but
Yeah.
I want to make sure that we look at
You
things
address
that
it,
an
sure.
individual can do.
Absolutely. I think even going a little bit deeper into that, when you talk about like the community gardens and things like that, you want people to access that, obviously, right? But I think the education goes a little bit further than that, and these are great points for you to not only nourish your body, but satiate your body, right? I think when folks in low-income communities think about feeding themselves, I don't think nourishment is necessarily the first thought. It's feed. I need to just feel full. I need to feel satiated,
Yeah.
right? So then you're going to the fried, you're going to the carbs, you're going to the breads, which necessarily aren't the most impactful when it comes to nutrients, right? So when you go to these gardens, again, the education is, or these community spots, the education is so important. Why do you need to do this, right? Not necessarily telling people, but letting them know, right? Wisdom is more better than the knowledge, I think, at that point, yeah.
Yeah, I love community gardens and all these different ways of transforming the food environments we live in. A lot of our approach has been around looking at the physical neighborhoods and
Yeah.
saying, what's physically here in the neighborhood and how can we transform it? One term that some folks use also is foodscape instead of landscape. How can we build a beautiful foodscape so that when you're looking out, you see lots of different opportunities to be able to eat healthy as opposed to the opposite. You know, so you see a community garden, you see a farmer's market, you pass the rec center and there's actually healthy foods inside. At the school environment, the vending is healthy and the school cafeterias offer good foods. You know, how can we transform all neighborhoods so that they have beautiful foodscapes?
Yeah.
Well, and it's interesting too because you think about, there was an article about portion sizes in restaurants, right? And the comments, I don't want to generalize, but a lot of the comments, many comments were divided along socioeconomic lines. Some of the people were saying, oh yes, you're right, portion sizes are too big. And then there were a lot of people who were like, look, I can only afford to eat out once a month.
Yeah.
And when I take something back from a restaurant, I can enjoy it the next day, or I can share it with my brother who can't afford to eat out at all. And so it's interesting when just the perspective change, you know?
Sure, yeah.
And so, yeah, it's just a lot of this is along those kinds of lines. Eric, you own your own business,
Yeah.
Pinch and Plate,
Yeah.
which is private dinners, catering, also pop-up dinners around the city.
Yeah,
I know
keep
you're
busy.
planning a restaurant, so
Wait, are you?
I am.
Okay.
breaking news.
Okay.
Yeah, so you want to tell us more right now?
We'll save. We got a couple
All
of
right,
things
I
here.
still got 2.5 minutes to work on you. Where do you get your ingredients from?
Oh man, I try to stay as local as possible, and there's a really great market in Tacoma, the Red Apple Market, that it's local to and it's communal, but it also sources a lot of great Caribbean and West African ingredients. So that's a spot that I enjoy. Union Market is a great place. And
I was just there.
Yeah.
It's
Union
very
Market is
cool.
amazing. And then literally the farmers markets in Silver Springs, just literally I try to support as much as possible and really put the work behind the gospel I try to preach at least, yeah.
Okay. So I want to talk in our last couple of minutes about reality TV, social media.
boy.
No, I'm not gonna
We want to know everything.
but how social media and reality television have affected the way that we eat. So right now, a big thing on YouTube are these like videos where people order a ton of food. They're called mukbang videos,
Yeah.
and people will order a ton of food. The host will
Wait,
order it.
what? I've not heard of this.
Yeah, it's pretty
Oh,
insane,
yeah.
actually.
I mean, go ahead. describe.
Explain.
Okay. To
Okay.
my knowledge, the best of my knowledge, is like it's really just people just ordering a bunch of food and eating it in front of the camera. It's super gluttonous. It's just
They get millions of hits.
yeah, and they get millions of views. It's just I don't know if
Wait, explain. Just in front of a table.
Just in front of a table, and,
And
they'll
just
have
eating a
like
ton of food.
5 pounds of crab legs with like butter and hot sauce, and just going at it.
Oh, okay.
And yeah. I don't know why.
And the quantity is
But
what it's all
people love
about.
eating
I guess
It's
so,
about
but people watch
watching
it.
it.
I don't know what it is. I mean, I think it goes to
I'm trying to understand.
So
America's infatuation. I know America's infatuation with just like
it's not just America. This is the thing.
Okay.
And so,
It's a lot.
well, the question is
Yeah.
between that and the advent of cooking competition television,
Yeah.
which is now it's been around for about 20 years.
Sure.
How is that affecting the way that we eat and the way that we perceive food?
I think the best way to answer that, I think, is with people are looking for sexy food, right? People are looking for Instagrammable food, right? So you have a lot of food that is really good and still nutritious and still as great as anything else, but doesn't look as good, right? Physically, and is getting put to the side. So a lot of people necessarily are looking at the meal and the product to be show worthy, right? And not necessarily like there's a show Ugly Delicious, I think.
Yeah.
Right, and it totally just evaporates that whole idea and that notion, right? But just going back to just food doesn't necessarily need to look and feel as beautiful as it just needs to, feed you and satiate you and bring you to a communal point, So I think that's one thing that social media and reality TV, it's probably my fault as well. But yeah, I mean, it all ties into a little bit. I think, that's pretty much, I don't know, it's a weird topic.
Well, I think also going back to Deepak's point about technology and how it can be used for good if we wanted to.
Exactly.
I'll just
right. Well
like
put.
take this in a different direction for
Well
a
said.
second,
Yeah,
which
absolutely.
is so for example in Philly, we were working with young people in high schools and things and saying to them, what would you want to do to make your school community or Philadelphia, where we're based? We work nationally, so
Sure,
we're based
sure.
in Philly. And said, what would you want to do? So there was one girl, Priscilla, and some others that worked with some of our staff, Ayanna Potts and Paulette Carpenter and others, and they said, we have a really bad water access problem.
Yeah.
And in fact, like all the water stations had these skull and crossbone kind of thing over it, and they were talking about what can we do to bring water into the school? So we worked with them, brought them to city council, they testified, they went to the school reform commission and talked about the problem, but it was over social media that, and working with Helen Gim, one of the city council women, but it was also over social media that we were also saying to the superintendent, like, let's do this, you can do this, let's put new water stations into all the Philly schools. And it was actually over Twitter that we found out, Dr. Haidt, who I love, the superintendent, says, okay, we're gonna do it. We were like, what? Okay.
Cool.
But it was actually over social media, he announced it.
Wow.
And now there's like, I think it's 2 or 3 new water stations in every Philadelphia public school, increasing access for 130,000 students.
So clearly that's the good what social media
But
can do,
and like you can
right.
encourage, like over social media, you can also give credit to people, and they can give like they can feel good about what they're doing, and
The kiss and the hug.
can like it can be retweeted, and
Yeah.
they can get really wonderful recognition over social media for doing the right thing.
Absolutely.
It all comes back to Deepak.
That's what it is, right?
It all comes
Just-
back to
I was
Deepak.
inspired.
I know, we all were.
brilliant.
Eric, I'm going to give you one more chance.
It's coming. 2020 is definitely the year that I have in
Okay.
mind. DC is the spot that I have in mind. Those like initial traction points are happening right now. So yeah, a lot more to come soon.
Do you want to give me a neighborhood?
Oh, wow. Oh, my goodness.
allowed to?
I don't know if I'm allowed to be honest, but I like Shaw.
You heard it here first. Thank you, my friend. Okay.
Oh my God, it's hilarious. She's good at what she does,
I feel
right?
so crazy sitting there.
Yeah, exactly.
All right. Unfortunately, really unfortunately, that's all the time we have for today. If I had another hour, I'd get the name too.
Right, yeah.
I want to really thank Eric Adjepong and Yael Lehman. Thank you so much for joining me. And it's a reminder to our audience, if you want to watch any of the interviews or tweet that amazing exclusive or selected highlights from today's program, head to WashingtonPostLive.com. Thank you all so much for being here. I think this was a great program
Pretty good,
this
yeah,
morning.
not too bad,
Yes. Thank you.
Thank you guys.
You're the best.
I was like, how well are you? So hilarious.
Oh, it's so good to see you.